Okay, so like I was telling, dopamine at low doses, less than 2, will act in renal and increase the urine output and cardiac output. And beta 1, it will act on 2 to 10 mmHg, so that time it will increase the cardiac output. Okay, and then at alpha 1, it will act on alpha 1 receptors if the dose is more than 10 microgram per kg, so it will act as a vasopressor, so it can be given for shock, hypotensive shock, and oliguria. So this is what happens if direct acting agonists are given. So these are non-selective drugs. Other drugs like phenaldopamine. Phenaldopamine is a D1 agonist which will again act in the renal system, causing vasodilatory action. So so it will increase the urine output. So it can be used in patients with hypertensive emergencies. And then we have isoprenaline. See, isoprenaline is a drug which will increase the heart rate. Primarily it will increase the heart rate, so it will increase the systolic blood pressure, it will decrease the diastolic blood pressure, but it will increase the heart rate. So that is why isoprenaline is more commonly given in patients with congestive heart failure and asthma and bradycardia. With bradycardia, so that is who primarily with patient presents with bradycardia, isoprenaline is much more preferred. Okay, so these are the drugs. And dobutamine, dobutamine is a selective beta 1 agonist. So what happens is it will increase only the contraction without increasing the heart rate. That is why it is used in dobutamine stress test. And it is also a drug of choice in hypertensive cardiac shock, in cardiogenic shock with inotropes, BP more than 90. So these are the non-selective agonists, direct acting agonists. Now the selective direct acting agonists are the catecholamines, non-catecholamines. These non-catecholamines will act on alpha 1, alpha 2, beta 1, beta 2, and beta 3. Now we told you what about non-catecholamines. They are long acting, they can cross the blood brain barrier, and they are very good orally. Orally they'll have good absorption. Now what are the drugs? Is okay, so in alpha 1 it will act on oxymetazoline and phenylephrine. So these drugs will help in congestion, that is why it's one nasal congestions it can be used. And also phenylephrine is used to cause mydriasis without cycloplegia. And they are potent vasoconstrictors, that is why they are used as nasal decongestants, oxymetazoline, xylometazoline, and all these drugs. And also other drugs like midodrine. See, midodrine is a drug which is used for orthostatic hypotension. It's also a alpha 1 agonist. So it's a vasopressor hypotension, so it will increase the BP. Other drugs like droxidopa is also given, but the actual drug of choice is mineralocorticoid. But if a vasopressor, if you want to give, you can give midodrine or droxidopa. Now other drug, next alpha 2 is clonidine. We know clonidine will decrease the BP. See, most of the sympathetic response will be increase in BP. Clonidine will decrease the BP. Clonidine will decrease the BP. At the same time, phenaldopam will also decrease the BP, and also dopamine can also decrease BP. So all these things are present. See, since it acts on presynaptic alpha 2, it will decrease the CAMP. It's a GI type of G protein coupled receptor, and it is also central. So it's also known as centrally acting antihypertensive drug. Other drugs is dexmedetomidine. Dexmedetomidine is a clonidine derivative. It also act on alpha 2 receptors and imidazoline receptor. So rilmidine, monoxidine, all these things are also centrally acting hypertensive. Now this rilmidine, minoxidine, imidazole, and clonidine is also used in ADHD, tic, and also withdrawal of symptoms in alcohol and opioids poisoning. Now, why do we give in withdrawal of alcohol and opium poisoning is, see, when there is an opium drug on withdrawal, the sympathetic overactivity will be decreased. This usually a sympathetic overactivity. If you withdraw a drug, there will be opium is like a central CNS depressor. It is like it doesn't act like that, but it's a CNS depressor. So once you remove it, there will be rebound tremors, tachycardia, sweating, anxiety due to stress symptoms, stress sympathetic overactivity. This can be reduced by giving clonidine, and also it can also be used as a sedative. So this dexmedetomidine, it also has an analgesic reaction, and an alpha 2 in skeletal muscles, it can like tizanidine, since tremors can be reduced, and also autonomic diarrhea clonidine will help in reducing the peristalsis. So autonomic diarrhea will be reduced. So diabetic diarrhea or autonomic diarrhea, all these things are be reduced. The other drugs are methyl dopa. These are also centrally acting antihypertensives like clonidine. But what happens is in methyl dopa, if you give it in if you give methyl dopa, some patients it can cause false hemolytic anemia or false positive Coombs test. Another drug is selective beta 1 is the dobutamine, which we've already discussed. Beta 2 is salmeterol, salbutamol, terbutaline, albuterol, short acting. Long acting is salmeterol, formoterol. Now the side effects will be tremors, palpitation. Now we know what does beta 2 do. What does sympathetic system do to the blood glucose? It will increase the blood glucose, so it will cause hyperglycemia. And one more thing you have to remember is it will cause hypokalemia. So this is the main important things you should remember. Side effects are tremors, palpitation, hypokalemia, and then you should know this, it will cause hyperglycemia. The other beta 2 agonists which are specifically in uterus is ritoridine and isosuxerpine, and also beta 2 vasodilator which is used in vasospastic disease, so this nilidrin. So all these things are beta 2 agonist, and beta 3 agonist is mirabigaron, which acts only on the urinary bladder. Okay, and then last is indirectly acting agonist. Indirectly acting agonist, what will it do? See, indirectly acting agonist will block the norepinephrine reuptake inhibitor, and also the it will also stop the MAO inhibition. So MAO inhibition will be not there, norepinephrine uptake will not be there, so there will be more of norepinephrine, epinephrine in the synapse. So these drugs are cocaine and amphetamines. That is why what happens when you give cocaine or when you snort cocaine and amphetamine, it is an addictive drug. What will it do? It will increase the BP. Sympathetic system overactivity will be there. It will increase BP, it will increase heart rate. Also, it will increase BP. It especially acts on the rewarding system of the brain in dopamine, norepinephrine and epinephrine. So that is there, and also that is why if you give any drug with MAO inhibitors, what happens is sympathetic overactivity will be there, increase BP, increase heart rate, you'll have CNS excitability, there will be more of rewarding system, so the reward center of the brain will be activated. All these things will be there. Okay, and see, so amphetamines will cause weight loss, increase BP, increase heart rate, seizure. That's why it has more of an abuse liability. Alright, so that is that. Now another drug is we talked about cocaine also, and also apart from all this sympathetic activity, it can cause corneal anesthesia, loss of corneal reflex, mydriasis. So if you give any drug with adrenaline, what happens is the end arteries, you should not give adrenaline, because the tip of nose, scars, ears and digits, what happens is there will be severe vasoconstriction and can cause necrosis. So other reuptake inhibitors are tricyclic antidepressants and atomoxetine, which is useful in ADHD, modafinil, which is also a reuptake inhibitor, which is useful in narcolepsy. So tricyclic antidepressants, atomoxetine, modafinil, then sibutramine, which is also a norepinephrine reuptake inhibitor. All these are other extra miscellaneous other drugs. You don't have to classify them in as such, but these also have an indirect action. The last type of drug is known as mixed acting mixed acting agonists. Mixed acting agonists are our epinephrine. Now, this epinephrine as a special, it has a special action on this. They have a long duration of action when compared to that of catecholamines. These are epinephrine and norepinephrine. What do they do? One, they bind to the alpha and beta receptors, and also it will increase the norepinephrine in the synapse. So it can cause severe vasoconstriction and bronchodilation. So basically, that is what it does. Also, okay, and since it has a good effect, phenyl and epinephrine is used as a nasal decongestant. So that is so it will increase the inflammation, mucus, and etc. So that's why it is used as a nasal decongestant. That is that for sympathomimetics.